My name is Crizel. I work as a nutrition clinical nurse specialist at Princess Alexandra Hospital NHS Trust. In this video, I will show you how to safely insert a fine-bore nasogastric tube for feeding in accordance to our trust policy. In inserting a nasogastric tube for feeding, confirm that this has been agreed amongst the medical or surgical team or the nutrition team. Once the plan has been verified, prepare the materials. What you would need are the following: fine-bore nasogastric tube. The standard size we use in our trust is 8 French or 10 French, and whenever possible, use the 8 French for the patient's comfort. pH strips. pH paper or strips must bear the CE mark, which confirms that they comply with legislation and have been manufactured specifically for the purpose of testing human gastric aspirate. 50 or 60 ml enteral syringe. Lubricating jelly. Durapore, which is about 1 centimeter wide. Receiver or vomit bowl. Box of tissues. Apron. Non-sterile gloves. Pen. A towel to avoid making a mess on your patient's dress. A glass of water or a squash with a straw, only if your patients are safe to swallow. Once you gather all the equipment needed, proceed to your patient. Perform hand hygiene before the procedure, then apply apron and gloves. Before you start, ensure to confirm you are with the correct patient. Hello, my name is Grizel. I will be your nurse for today. Can I take your name, please?
Hi there, this is Adam Young.
And what's your date of birth, Adam?
It's 12 of April 1956.
Thank you for giving me your details, Adam. At the moment, you are unable to swallow food safely, and because of this, I am going to insert a fine-bore nasogastric tube through your nose and into your stomach. This will aid you in receiving food, fluid, and also your medications. It might be a little bit uncomfortable, but it shouldn't be too painful. I will use a jelly to help the feeding tube slide down easily. I would also be needing your help to swallow, as this will help the tube to go down. If it gets too uncomfortable, let me know and we can stop. Are you okay for me to go ahead with the procedure?
Yes, that's fine.
Prepare the patient by applying a clean towel over the chest. Check and clean the nose, ready for the tape to secure the tube after the procedure. Position the patient upright to prevent aspiration from gagging and retching. Measure the desired length of the tube to be inserted. Use the next method in measuring the estimated length of the insertion. Do this by measuring the tube laterally, in parallel to the tip of the nose, earlobe, and measure it down to the cephus sternum. Document the insertion length. Lubricate the tip of the tube. Inform the patient that you are commencing the procedure. I am going to put the tube in now. It might be a bit uncomfortable. If you can swallow down while I am advancing the tube, it would be helpful. Let me know if it gets too uncomfortable or raise your arm if you want me to stop. Gently insert the NG tube into the nostril. Advance the NG tube until you reach the desired length of insertion. Ask the patient to swallow down as you advance the tube. Adam, would you be able to swallow down, please? Thank you. Can you continue swallowing until I completely place the tube? Inspect the patient's mouth to ensure that the NG tube isn't coiling. Would you be able to open your mouth, Adam? Do not forget to provide reassurance to your patients all throughout the procedure. Let them know that they are in control. You are doing well, Adam. We are just 10 centimeters away from the insertion length. Once you reach the desired length, hold the tube in place or ask someone to hold it for you. Secure the tape using a hammock technique. Attempt to aspirate 3 to 4 ml of gastric contents using a 50 ml enteral syringe with or without the guide wire. If you obtain a pH of 5.5 and below, the feeding tube is ready to be used. If you obtain a pH of about 5.5, review your patient's medication. pH levels are affected by proton pump inhibitors like omeprazole, lansoprazole, and esomeprazole.
If you can't get any aspirates and tried any other methods to do so,
Inform the medical team, the surgical team, or the nutrition team and ask for their decision. Do not forget to discard your materials, wash your hands, and do your documentation. Thank you for watching. If you have any concern or requires further assistance, feel free to contact me through Alertive as a nutrition practitioner or through extension 8533.